This video comprises part 1 of a 4-part series discussing the clinical research study entitled Improving Satisfaction in Intimate Relationships. This video describes a study that was conducted and written by me, Kathryn Vannauker. I hold a Bachelor of Psychology and Master of Arts degree in Counseling Psychology. I am also a licensed marriage and family therapist in the state of California. This study was submitted to Blue Marble University in 2015 in fulfillment of the requirements for the degree of Doctor of Philosophy in the field of clinical psychology. My academic advisor was Dr. Professor Beck. In this video, the terms participant and client will be used interchangeably. Abstract. Abandonment fear is a construct that has been long associated with a person's relationship with friends, family, and partners due to its impact on one's behavior within those relationships. The present research study examines the correlation between abandonment fear and relationship satisfaction of clients and their partners in intimate relationships. The study is significant in the field of clinical psychology and mental health, as it contributes added knowledge to the role of abandonment fear in relationships and how this construct impacts the satisfaction perceived by members of a romantic relationship. The purpose of this study is to review and present findings that may be beneficial to mental health professionals and individuals who are in a relationship or are planning to start a relationship. Introduction: Abandonment fear. The term abandonment has been used to characterize a great number of experiences, including relationships in infancy and childhood, in prior intimate relationships, and in the current romantic relationship. Within the current romantic relationship, abandonment has been measured by looking at the participants' previous breakups with their partner, times in which they have felt emotionally abandoned by their partner, times when they have felt that they have not had their material and financial needs met in the current relationship, and times when they have felt betrayed. These constructs have been measured separately and together, with no clear definition as to exactly what abandonment means and what it is caused by. In the current study, the term abandonment fear is used to describe the level of fear that a person has that their partner will abandon them or leave the relationship. The purpose of this study is to research the correlation between abandonment fear and relationship satisfaction in the current romantic relationship. For the purposes of this study, abandonment fear will be characterized by any experience in the participant's past and any current experience that leads them to be fearful that their current partner will abandon them. Abandonment fear in this study may be comprised of any of the previously mentioned causes of abandonment fear and additional causes that have not yet been measured empirically. I have chosen to measure abandonment fear in this manner, as abandonment fear, as defined this way, is the most directly applicable construct to the therapeutic setting. Clients do not present in therapy with their abandonment fears carefully separated into distinct constructs. Rather, they present with a whole gamut of experiences that have caused their current fear of abandonment by their specific partner, related to their childhood's upbringing, past experiences in relationships, their experience of the current relationship, etc. Abandonment fear, as defined by the participants' unique experiences of the above events, is what I seek to measure. Relationship satisfaction. Relationship satisfaction has been described as some sort of summative judgment on behalf of the members of the couple about the intimate relationship, according to Hendrick, 1995. Client's abandonment fear and client relationship satisfaction. There are no existing studies that measure the correlation between a client's level of abandonment fear and the client's relationship satisfaction. Client's abandonment fear and partner relationship satisfaction. There are no existing studies that measure the correlation between a client's abandonment fear and their partner's relationship satisfaction. A more complete literature review with references can be found in my thesis. The findings of previous researchers have indicated that abandonment fear is one of the factors that influence the health of a relationship. However, whether there exists a direct relationship between abandonment fear and relationship satisfaction has not been explored. Although theoretical postulations suggest a direct correlation between the general concept of abandonment and relationship satisfaction, further research is needed in order to determine the nature of the relationship between abandonment, and more specifically abandonment fear, and the relationship satisfaction of both members of a couple. The current study aims to address the gap in the literature concerning the direct correlation between abandonment fear and the relationship satisfaction of both client and partner in intimate relationships. This is an area that has not been previously explored in research studies. It is proposed that the topic of this research project will contribute to the field of clinical psychology by giving psychologists, professionals in the field of mental health, and the general public further information as to the role that abandonment fear plays in intimate relationships. It is hoped that the findings generated by this study will allow mental health professionals and the general public to understand the unique challenges that people with certain levels of abandonment fear are likely to experience in intimate relationships. As understanding of the issues at hand is an essential step to solving any problem, it is hoped that by understanding the levels of abandonment fear that members of a couple have, and how this can manifest in the intimate relationship, empathy for oneself and one's partner may result, and healing may begin. Knowing the strength of the correlation between abandonment fear and the relationship satisfaction of clients and partners as a result of this study may lead to the selection of more appropriate and effective treatment techniques on behalf of the treating professional, which is likely to result in an acceleration in progress toward treatment goals. Finally, it is hoped that findings of this study will lead to further research as to how different levels of abandonment fear might be managed through the creation of new tailored therapeutic techniques aimed at reducing the negative impact of abandonment fear on the client, his or her partner, and the relationship in general. It is also hoped that the application of these tailored techniques will lead to more prompt and complete healing of the client's abandonment issues and lead them to enjoying more satisfaction in their intimate relationships. Most mental health professionals would assume that when a person has a high fear of abandonment, their relationship satisfaction will be lower than a person who has low abandonment fear. I aim to assess whether and how the level of abandonment fear of a client impacts the client's relationship and the satisfaction that their partner finds within the relationship. For the purposes of the current study, the member of the couple with the higher level of abandonment fear was identified as the client or type A participant. The member of the couple with the lower level of abandonment fear was identified as the partner or type B participant. These identification titles were assigned so as to differentiate the two groups of participants. In summary, I propose that the client's or type A participant's level of abandonment fear will be significantly correlated with his or her relationship satisfaction and the relationship satisfaction of their partners or type B participants. More specifically, I propose that the higher a client's abandonment fear level, the lower the client's and participants' relationship satisfaction will be. Research hypotheses. The present study will test the following hypotheses in order to investigate the nature of the relationships between abandonment fear of the client and the relationship satisfaction of the client and the client's partner. My specific hypotheses are: Hypothesis 1. Clients with high abandonment fear will have lower relationship satisfaction than clients with low abandonment fear. Hypothesis 2. Partners of clients with high abandonment fear will have lower relationship satisfaction than partners of clients with low abandonment fear.